Today we have Dr. Anju Jha, a consultant dermatologist from Ghaziabad, live with us to educate us more on acne management in summer. Dr. Anju Jha is a dermatologist in Ghaziabad and has an experience of 22 years in the field of dermatology. Dr. Anju Jha practices at Medieval Skin Clinic in Vaishali, Ghaziabad, and Medieval Skin Clinic in Vasundhara Enclave, Delhi. She completed MBBS from Medical College, Calcutta in 1996 and MD Dermatology, Venerology and Leprosy from Government Medical College and Rajendra Hospital, Punjabi University, Patiala in 2001. Today, Dr. Anju Jha will share us each and everything on acne management in summer. Welcome, Dr. Jha. First of all, I would like to ask you, as today we are talking about acne, and that's really so depressing and distressing for the sufferer. What are the basic causes of acne? What causes acne?
Yeah, good afternoon, everyone. So the causes of acne. What is the cause of acne? Acne is actually a problem of adolescence. Acne will occur in adolescence age group and in young adults. So what happens is during this age group, there are certain hormonal changes. During puberty, there are hormonal changes. The action of hormones on the sebaceous glands on skin causes formation of oil and sebum. This sebum, along with the dead follicles, it clogs the pores and results in the formation of comedones. And there are certain commensals also in our skin, bacteria known as Propionibacterium acnes. Now, whenever there is a coagulation of the sebum and dead cells, there is an inflammatory reaction caused by these bacteria, resulting in formation of papules, the red lesions and pustular lesions causing acne. So it is mainly hormonal. But why do we see that in certain people will have more of acne, some will have less of it? So the difference is because of other factors. Now, these other factors, the genetic factors is one of the most important factor. So if one of your parent or sibling is suffering from, had suffered from acne during their age group or is suffering from acne, then there are more likely chances of developing acne. Then there are dietary factors. Then there are certain medicines which can cause acne. And obviously there are now all these acne which is occurring in adolescents and young adults is what we call a physiological process, and there can be slight aberration from this process. But there are certain acne which we call adult onset acne, which usually occurs after age of 20, which keeps on persisting after 25 years of age also, and can continue till 40 years of age. Now, in these individuals, we need to see which type of hormonal problem they are having. Then we need to investigate whether they are having some hormonal problem. Are they on any medications which are causing acne? So these are the different causes of acne.
Right. So now we are clear about the causes of acne, at least. Moving forward, I would like to ask you, Dr. Jha, we all know that heat or summer season is really bad for our skin. And for acne, it's more worse. Can heat cause summer acne breakouts? What's your, how would you like to address it?
See, so I would like to say that heat alone will not cause much acne, but heat with humidity and sweating will definitely cause more acne, because what happens, the inflammatory action on the skin, on the acne producing areas, that definitely increases. These pilosebaceous glands are present on the face, and there is more sebum secretion due to sweating. The activity of Propionibacterium can be more, the multiplication of bacteria is more. So if you're having more of these bacteria, more inflammation, then you can suffer from more acne. So one of the reasons why these days people are wearing masks and sweating is more, and can definitely result in causing more acne.
Right. So I'll come to the fact that nowadays, as we are using more of masks, the acne breakouts are more. But before that, I'll also like to ask you, supposedly there is a person who's already suffering from acne, or who has this acne prone skin or tendency of having acne. Now, can this summer heat make the acne, which is already there, worse?
Yes, it can definitely make it worse. So you need to keep your face clean. You need to wash your face twice or thrice daily. You can keep on wiping your face to remove the excess oil from your face, the excess sweat from your face. So definitely, if a patient is having acne, or there is a tendency of having acne, acne breakouts can be more during summer season.
Okay, and how to prevent summer acne breakouts? How can we safeguard our skin from acne?
Yes. So for that, what we need to do is uh, our skin. Actually, first thing is wash your face properly. Wash it at least twice a day. Use a gentle cleanser. Don't scrub your face a lot. This is very important. That at times people think that scrubbing a lot will help, but actually it can cause breakout of acne. So this should be avoided. And wearing a light makeup is very important. Using creams which are non-comedogenic is very important. So you can use a sunscreen which is gel based or which is water based and can cause less problems during summers. So these factors are very important during summers.
And what treatments do you recommend for summer acne? Because a lot of people are there who are suffering from it.
For summer acne, obviously, what we would recommend is we have actually, whenever we see a patient of acne, actually we categorize them accordingly to whether they're having mild acne, or they are having moderate acne, or they are having severe acne. So a mild acne patient will have comedones and maybe one or few papules. For these patients, we recommend few topical agents in the form of adapalene or retinoids, and they are supposed to apply once daily at night. Along with that, if required, if at times what happens, the remaining face is dry, so the patient might need a moisturizer. So the moisturizer has to be a non-comedogenic one. So these are the things we do. For a moderate acne with few more papules and pustular lesions, one might have to go for a course of antibiotic. Now we have to understand that antibiotic which we prescribe in acne is certainly different from the other antibiotics which we take for short periods. Here we give them for longer periods, and the idea is not to suppress the infection but to stop the inflammation. So I would recommend everyone to follow your doctor's advice properly.
Yeah, so yes, please go ahead.
And in severe cases, one might have to take oral isotretinoin. So these are the things which can be done. And obviously, along with this, treatment is one thing. We are treating the acne, and the other thing is we need to prevent also acne. So for that, we recommend face wash, we recommend moisturizer, sunscreen. According to it, everything is individualized. So accordingly, we prescribe these things also, so that the patients know which things are correct to use.
Right. So every individual is different. His or her skin is different. Thus, the cause may be different. But it's important to A, precaution is always better than cure. So prevent it. B, if you're having or you're suffering from acne, go to a doctor, go and meet a dermatologist and follow the doctor. I would also like to know, Dr. Jha, that during summers, because when we are out, our skin gets dry through the heat or heat waves, whatever. When we are in our house or office or indoor, we are there with AC or cooler, it actually makes our skin even drier. How then to prevent acne, because acne is again a very dry thing, it just breaks out and makes our skin look really depressing, and plus all the heat wave and AC is anyways aggravating the whole condition. What's your take on it?
So my take on it is, actually, I've already mentioned that during the treatment of acne and otherwise also, a patient needs moisturizer also on body and face. So the moisturizer on face, what we say is that one should use something which is non-comedogenic. So you should be very careful in choosing your products, and it should be mentioned on those products that they are non-comedogenic. They are not very thick creams. They should be in lotion forms, or even the sunscreens which we use while going out should be gel based, should be water based, should be either in matte finish, and should be non-comedogenic. So these are the things which we need to look out for. And it is also very important. See, while we are giving treatment for acne, the retinoids, the isotretinoin, or whatever is making the skin more dry. So what happens, the remaining skin can become very dry, and it is important that you moisturize the skin also while taking treatment, or else, or otherwise also, one needs to use these things accordingly.
Dr.
According to the
Jha, would you recommend that before we buy a moisturizer or a sunscreen, if we have an acne prone skin, then we should first go to our dermatologist, meet the dermatologist, and then take his or her advice about what kind of moisturizer should one take? Because otherwise, what happens, because there's so much of advertisements and so much of this, the business gimmick going on, that there's so much to choose from, but we don't know which is the right one for our skin. So, do you recommend going to and meeting a dermatologist?
This is one of the very important things which we stress to our patients, that one should use a thing which is recommended by a dermatologist. We also make sure that these products which they are using as maintenance products are always better than the ones they are buying from outside the shop, or from what their friends are suggesting, what the parlor wali is suggesting. So it is always better to take the advice of, because it is very important that what you are applying during your maintenance regime, that is going to prevent your further outbreaks of acne. Acne is not a one-time problem. So it is very important that you consult your dermatologist as to which products you have to use regularly, in addition to obviously the treatment part.
Right. So do what the doctor is saying, and thus, if you are suffering from acne or you have acne-prone skin, please meet your doctor. Dr. Jha, how should you deal with a sunscreen acne allergy? Can we use customized sunscreen? A lot of customized sunscreen, customized moisturizers are also available these days. So for acne and acne-prone skin, would you like to recommend customized sunscreen?
Definitely. Even sunscreen application is very important. So initially what happens that during treatment of skin, while we are treating them, a sunscreen at times is required to prevent the post-inflammatory hyperpigmentation. So when the lesions are healing, it needs to be protected from the sun. So a patient who is already having so many lesions of the skin, and we are telling them not to apply too many things on face, but you have to apply a sunscreen at times according to your routine activity, or if there is a tendency of post-inflammatory hyperpigmentation. So these sunscreens, the composition of sunscreen is very important. It should be non-comedogenic. It should be in gel-based or water-based, or it should have a matte finish. And all the specification, we always tell our patients that what you are using or taking from a doctor, or taking taking advice during a doctor visit, you know what the constituents are. On the other hand, when you are procuring these things from outside, you actually don't know whether the things are comedogenic or they are the reasons for causing your problem. So I think there are specific sunscreens, and we have specific sunscreen for every stage. So when you will have more of lesions on the face, we would suggest something which is gel based. During the maintenance phase, we will switch over to something with a matte finish, which is not a very sticky one. So very thick creams. At times people think that buying a very high SPF from outside would help, but we make it clear that this is not so. So one should take advice from your skin specialist regarding choosing your sunscreens and moisturizers as well.
Right. So please take advice from an expert like here. This expert, Dr. Anju Jha, is telling us that go and take the advice of a doctor, dermatologist. Dr. Jha, I would also like to ask you that do you prefer going for medicated sunscreens or medicated moisturizers over the ones that is available on the shops and everywhere and on the television as well with their
tell them that any day our sunscreens are better. Don't take them only during our treatment, but do take them during the maintenance period as well, and then you'll be fit and fine. So whatever you have will be less, and you will not have more of recurrences if you're using these products.
Right.
You can use them all.
And as you have spoken about it very briefly in the beginning, the COVID era has, everybody using the mask, and even not only for the, to stay away from the infections, but also to stay away from the smoke or pollution. A lot of people are using mask, and during summer, it becomes so hard to survive with a mask on because you have all the sweat accumulated inside your mask. So now I would like to talk about mask acne. How should we deal with summer maskne? Please tell us.
So regarding mask acne, what I would suggest is few things are very important. First, during this summer season, one should change their mask definitely daily. And in between, if you feel that you're sweating, then you should keep on, either you keep wipes along with yourselves, or you keep a face wash. And if you have nothing, just wash your face with water and keep a neat and clean handkerchief just to keep on wiping your face time and again. And don't use those synthetic masks made of clothes and all, where the accumulation of sweat is more. Number two, in between, whenever you have time, you should just remove your mask and cleanse your face according to the type of skin you have. And definitely changing the mask daily would be very important.
Yes, so your mask should be clean, it should be airy, it should let you breathe properly, let your skin breathe as well, and please maintain the hygiene factor. It's very important for your skin as well as your overall health. Dr. Jha, I would also like to know that we say that it's very important to follow a daily routine, daily skincare routine. Now with acne, the problem is that if I go for a lot of washing or a lot of face wash or cleansing, it may have this tendency of breaking out and spreading into other parts of my skin. Maybe that's possible. I'm not certain about it. Otherwise, if I do a lot of exfoliation, you have already said that scrubbing or overdoing scrubbing is not a good thing. So what should be, if I'm an acne prone, if I have acne prone skin, what should be my daily routine of skincare?
So your daily routine of skincare is actually very simple. So what you need to do is, first thing in the morning, wash your face. As I've already said, gentle cleansing is very important. Don't scrub your face. While scrubbing, you might pick on those acnes, and something which can heal in otherwise 10 days might take longer, because if the sebaceous glands, it ruptures inside the skin during cleansing, the inflammatory reaction can be more. So that papules, which usually can heal in 7 to 10 days, might take 15 to 20 days and leave a pigmentation as well. So it is important that there is a gentle cleansing of face, followed by whichever routine moisturizer the doctor has prescribed. Please, it is very important to know that while during treatment, apart from the routine medications, one should always follow the moisturizers and sunscreen recommended by the doctor. So you put your moisturizer, and then you put your sunscreen. Now, if you feel that the sunscreen alone is sufficient, then you can leave the moisturizer also during the morning time. And after that, if someone is going out and you need to put a slight makeup, that could be in the form of some talcum powder or compact, that's all. Your base moisturizer and sunscreen should be the once prescribed by the doctor. It is very important because during treatment, your moisturizer and sunscreen can be of one type, and afterwards, if you need something else, that can also be prescribed. So these are the things one needs to do. And evening also, when we ask our patients to apply the medicine, you need to cleanse your face, apply a moisturizer, and after half an hour, you can put your medicine on the affected area so that there is no problem during treatment also. And once you are okay, obviously, you can carry with the things which are already advised.
Right. And doctor, how important is diet to curb this acne issue? And a very important thing is that people many times say that milk and dairy products, they aggravates the acne breakouts. Is it true, or it's just a myth? What's the theory behind this belief?
So what happens is the diet has been a very controversial part since long, but researchers over many years have proved certain things to be very strongly implicated as a cause of acne. One of them is a high glycemic index diet. So what happens is your the food intake, the things which you're taking should not have a high glycemic index. So what do we mean by high glycemic index? You eat something and your sugar level rises a lot. So those things one needs to avoid. So what do we put in those things? So most of the junk food, then chocolatey food, sweets, white flour. So these are the things which we need to avoid. And then coming to dairy products, dairy was again controversial for long, but now we do ask our patients to take a little less milk. Excess milk should not be taken, but one can take curd and paneer, cheese. All these, they should be taken in limited proportions only. Yes. So there's a dietary plan which goes for acne patients. And again, if the patient is having PCOS or is obese, then routine, we always ask them to decrease their carbohydrate and fat intake.
Right. So it's important to take care of what you are intaking, what you are eating. So that's very important. We would like to include some of our viewers' questions. So Suman Yadav is asking that I'm not a teenager. Why do I still have acne?
What is her age?
She has not mentioned her age, but she is not a teenager for sure. And she is really distressed about it, that why still she is having acne.
Whether she is young or she is old, actually, see, these days we do see acne in patients as young as 9-10 years also, when the skin T-zone starts becoming oily. But I think she is, her age is more, that is why she is saying. So in these cases, what happens, as I've already mentioned, that these days we do see a lot of cases of adult onset acne, and we need to check for the hormonal problems in such patients. So earlier, what we used to know as polycystic ovarian disease, which used to occur only in obese individuals, but these days we do see lean PCOS. Patient is not obese, they don't have any other overt problems, but still they are having acne. So what you need to do is take care of your diet, take care of your sleep pattern, your routine activities, your daily exercises. So these things are very important to address.
Right. So it's not just about your skin, it's about your whole well-being. Thus, a very healthy lifestyle is what you need to prevent or to get cure of all your skin-related problems as well. Sonali Verma is here, and she is asking, what level of SPF should I wear? And I think we would like to have some clarity on SPF, Dr. Jha.
Yeah. So it is a myth, actually. The higher the SPF, the better the sunscreen is. Actually, for Indian skin, the SPF, anything under 30 is, around 30 is good enough. Until and unless you have a very long sun exposure, you can go for higher SPFs. But for a normal individual, anything around 30 would be actually good. And you should always apply your sunscreen 15 to 20 minutes before going out. You should repeat it after 4 to 5 hours if you're going out again in sunlight. So these are the things you need to take care.
Okay, so now we know what SPF to use. Ali Hussain is here and he's asking, what can I do to keep my skin healthy? A very generalized question. We would like to know your thoughts on it, Dr. Cha.
So see, for keeping a good skin, according to me, don't need too many things, too many applications on face. You need a good moisturizer, you need a good cleanser, a good moisturizer, and a good sunscreen. For me, these three things are enough to keep your skin glowing and healthy. And obviously, apart from that, your diet should be good. Your routine activity should be okay. You should not be obese. There should be enough exercise daily, and you should be at mental peace. So these are the things I think goes a long way.
Yes.
Skin radiant and glowing one.
Yes, so it's all interconnected. If you want a good, glowing, healthy skin, then you need to take care of your whole routine. You should be mentally at peace, no stress. You should sleep well. You should eat well. You should do some physical activities, and that all will keep you and your skin in a good shape. Shruti Nigam is here and her question is कि मेरी स्किन ड्राई है और समर में मैं किस SPF का सनस्क्रीन यूज कर सकती हूँ डॉक्टर.
So if your skin is dry, obviously you can use, if you're not having acne, you can use a oily sunscreen also. If your skin is dry and still if you have acne, then obviously you need a sunscreen which is gel based, or water based sunscreen should be light on skin. So these are the things which you can use.
Right. Nilesh Singh is asking, what exercise routine should I follow? I think he's asking about the whole well-being of a body, but still, if you would like to comment on it.
So these days, what we see is people, they go a lot to the gym. And one thing I would like to mention, since I've spoken about gym, is that one should stay away from whey protein, because whey protein is again has a very high glycemic index. And it is not necessary that you have to take a very vigorous activity. It can be something as simple as 30 minutes of brisk walking 5 days in a week. But you have to do it at least 5 days in a week. And it could be in the form of any yoga. It could be in the form of playing badminton or cycling, anything which you love to do and would do regularly.
Right. So do it, love it, and do it regularly. That's why it's important that you love what you're doing, because then you'll get yourself motivated to do it on a regular basis. Shubh Maran is asking, are my current skincare products adequate to address my needs and complement my procedure? I think Shubh is seeking an advice that what else should I do, rather from out of my routine skincare. So are my current skincare products adequate to address my needs? That's his question.
No, exactly. I could not get what he wants to ask. He's asking for exactly what type of thing. I could not get the question.
Yes. Actually, it's not clear from his question that what answer is he seeking. What's his question? So maybe if he's still online and listening to us, please Shubh, make your question more elaborate so that we understand.
That apart from the routine care, what you need to do for a good skin. So actually, that is a very individualistic question. So I need to see the patient. If you think you can go for a peel sitting to make your skin glow more. So there are few things which you can do to make it better, but then everything is not a generalized thing. I have to see the patient and then I can advise it accordingly.
Exactly. Nisha Sharma here is asking a very important question. I think most of our viewers also have this in their mind. And the question is, do home remedies for acne really work?
Oh, so as a doctor, what I tell my patients is, like once you are on treatment and taking treatment, then don't apply any of those home remedies, because the thing can cause contact dermatitis and all. But otherwise, if someone is applying multani mitti once in a while, it is okay. If you're scrubbing you don't have acne and you're scrubbing your face once in a week, that is okay. But if you have a acne prone skin, we do advise them, don't use any oily products on face. It is very important that there are cosmetics which contains oil and they can clog the pores. So one should avoid them.
Yes, and Soumya Shukla is asking what causes sensitive skin reactions?
Which reaction?
Sensitive skin reactions.
Okay, fine. So what causes these sensitive skin reactions is there are people who have a very sensitive skin. When we say sensitive skin, what we mean is in certain changes of weather also their face will tend to become dry. Or even if they are having acne, the acne can be present in the T-zone and the remaining face can be very dry or irritated. Or if you apply most of the products, you might feel they are not suiting your skin. So in these cases, what we advise is that your face wash should be a very soft one. It should be a very gentle cleanser. You should always moisturize your skin, and your medicines will be also given accordingly. And what causes them, I think it is a variation. It is a individual variation which can occur from patient to patient, and someone can have a dry skin. And one needs to be careful about using a good face wash and a good moisturizer in such cases.
Right. We have another viewer, Ruchi Sharma. Her question is, what's the difference between acne and rosacea? I'm sure I'm pronouncing it the right way.
Rosacea. Yeah, rosacea.
Yeah, rosacea.
So the difference between acne and rosacea is there. Acne is a problem of young age. It is a problem of the pilosebaceous gland, whereas rosacea can have a similar appearance. There is only one type of lesions. See, in an acne patient, what we will see, there will be small comedones, there will be some red bumps, there can be yellow bumps. So there's a combination of things. But in a patient of rosacea, what we see, it is a monomorphic picture. There will be one type of red lesions, bumps. Again, it is present on the central area of the face. The nose can be affected, the cheeks can be affected, and your eyelids can be affected as well. So the precautions, the medications, everything is different in a case of rosacea. It is also an inflammatory pattern of a skin which occurs in certain patients, and the treatment is different, and you can always seek a help of your skin specialist regarding this.
Right. I think the bottom line is that we should seek the advice of a dermatologist. What happens nowadays that we know how to surf, we know how to Google, and as we do a lot of Googling and surfing, we become a doctor ourselves, which is not good, and it's not going to be good for your skin or your health. Please go and seek the advice of an expert. Now, there is a question, how can I treat sunburn, from Sonia Iyer. How can I treat sunburn?
So once if you have already had a sunburn, then you need certain antioxidants, you need certain medications to be applied on the skin, you need certain cooling agents which needs to be given. But in case you don't have any and it is an emergency, you can always use some cooling products. You can use calamine lotion, and from next time you can definitely use a good sunscreen.
Right. Shekhar Mishra is asking, again, a very valid question. Maybe a lot of myth is associated with it. Is steam good for our face during summer?
See, again, a very important question. There are many people who think that if you take a lot of steam, you actually you can clean your pores better. But you have to understand one thing, that all these processes, they are not a one-time thing. You clean it and it is gone. It is nothing like that. So you need to clean your face daily. You need to clean it twice. And at times, steam can cause open pores. So after, you must have seen people, those who have the acne has gone after many years, but their pores seem to be very big, or open pores, what we call. So I think excessive steaming should definitely be avoided.
Right.
And nothing that we recommend our patients.
Right. It's good to see that a lot of male participants are also here, and they are also asking questions regarding healthy skin. Vikas Parihar is here. Ma'am, how can we make our skin glow during summer? Because in summers, normally our skin becomes so saggy and dull. So he's trying to know how can my skin glow during summer.
So what you can do is, again, as I've already mentioned, you can use a good moisturizer, a good sunscreen. You can use vitamin C serums also on face. And on top of that, if you feel using a sunscreen is making your face look oily, then you can dab a little bit of talcum or compact according to whatever suits your skin. And always remember that keep yourself hydrated, eat good, eat lots of seasonal fruits and vegetables, and don't eat junk food only.
Right. So avoid eating junk, avoid eating a lot of sugar or white flour, as Dr. Jha has already mentioned, and keep yourself hydrated. Drink a lot of fluid during summer. Keep yourself cool, and take good care of your skin. Now, Vikas Parihar is asking another question. What products should everyone have in their skin care routine?
What products everyone should have? See, if you ask me, I will say you need only three things. You need a good cleanser, a good moisturizer, and a good sunscreen. Moisturizer you can always do away with in excessive summers, but again, in summers, what you can do is you can apply your sunscreen in the morning, and you can use your moisturizer when you're sitting or sleeping in the AC or sitting in the room. So it is a combination. I think these three things are enough for a good skin.
Right. So I'm sure Vikas has his answer. Asha Sharma is asking, and she is saying, please answer my question. We'll definitely address your question, Asha. Her question is, I'm 42 years old. I want to know when should I use rose water on face? Now, a lot of people use rose water, and especially during summers, they feel that it will keep your skin cool.
Yeah.
So what's your take on this?
For the rose water, we don't have any problem. So it is something which has a good feel factor, and you can always use it, and you can use it any number of times, twice or thrice if you are using. You can use it with your moisturizer or after it. And since it does not contain any oil, and if it suits your skin, go with it.
Dr. Jha, we have seen that that people normally use a lot of hands over their face. They love touching their face all the time. Now we know that our fingers are really exposed to germs and variety of bacteria. We don't clean our fingers well before touching our skins, especially with the acne-prone skin. Is it advisable, or what would you like to say about it?
See, for others, actually, we are not bothered. But for acne-prone skin, we always tell our patients to don't pick your acne. See, the thing is, if you pick your acne or if you touch them a lot, then there are chances of post-inflammatory hyperpigmentation. As I've already mentioned, acne, which can become okay on its own also at times in 7 to 10 days, can take 15 to 20 days or even a month's time if you keep on picking on them. So definitely putting your hands on face is a complete no for a patient of acne.
Right. So if you have an acne prone skin, please keep your fingers, your hands away from your face. That's what is advisable. Shiva is asking which bacteria can cause acne. A very scientific or science-based question. He is asking which bacteria.
Okay, fine. So let me make two things clear. See, when you have acne, there is a commensal which we call acne, Propionibacterium acne, which is causing this inflammatory reaction of acne. So I think what he is trying to ask, in summers you can have, in addition to Propionibacterium acne, you can have more of staphylococcal infection, streptococcal infection on skin in hot and humid skin weather. So if you have one of these, then your boils will not be the typical acne one. You can have a very painful, inflammatory, big red bump, which will need a course of antibiotics. So the bacteria can be different, but most commonly what we see in acne patients, that is Propionibacterium acne.
Very good. Dr. Jha, just to sum up, any special points, or would you like to summarize the whole things in few words so that those who have joined now can know how to keep yourself fit and how to keep your skin acne free?
Okay, so let me sum it up in this way that even though acne is a problem of young age, Never think that you can outgrow your acne and it will become okay on its own. If you have little problem, it's okay. But if you have lots of problem, if you have lots of acne and you're finding it difficult to deal with, always consult your skin specialist, because then there are certain things which needs to be taken care of. Once you consult your dermatologist, you know exactly which products to use, how long to use them. It is very important that once you take treatment, the things which will otherwise take long to heal will leave scars, will actually improve soon, and your complications of acne will be less. So always consult a skin specialist if you think you're finding it difficult to deal with your acne. And always remember that acne is something which does not come in 2 days time and will go away in 2 days. So you have to be patient with your treatment. The treatment of acne, suppose if you are coming to a doctor for a acne, your acne is of a more often it is of a moderate severity. So if you are having acne of a moderate severity, the time taken to heal would be something around 3 months, and you can see improvement maybe in 3 to 4 weeks time only. So you need to be patient and follow all the advice, and your pattern of treatment will be always decided by the type of acne if you have. So it could be only a topical, something to apply. It could be something oral, with oral medications can also be given at times. And these oral medications are always to be taken for a month's time, 2 months time, and rarely maybe 3 to 4 months also you need to continue these medicines. Lastly, always remember that if you have an acne prone skin, you don't need the protocol you need to follow is actually not a very complicated one. You need to use a good face wash. The face wash will be according to the type of skin you have. Your skin can be a dry skin, it could be oily skin, or it could be a combination skin. So the face wash will be given accordingly. You need a moisturizer, and your moisturizer and your sunscreen is also important part of your regime. And again, these two products would be should be non-comedogenic, and always ask your doctor to prescribe a few products, and then always stick to these products whichever suits your skin. I think that's all.
Right, that was really very, very advisable. And acne is not that uncommon. We all go through it once or more. So, what's important is that we follow a good lifestyle, a healthy lifestyle, stay away from stress, because nowadays stress is what actually keeps us in a wrong place or in a wrong frame of mind and body. So, please take good care of you. If you have acne, your skin is acne prone, do take advice of a dermatologist. That's very, very important. And rest, everything has been very well defined and explained by Dr. Anju Jha. Thank you very much, Dr. Anju Jha, for your valuable time. And it has been quite an informative session for our viewers as well. We really look forward for many more such sessions in coming times. Thank you, viewers, also for an excellent participation.
Was as well. Okay.
Thank you. And viewers, for more information and updates on BPH, stay connected on our FB page, Beautiful Spotless Skin. We are also available on YouTube, Twitter, and Insta. Thank you and good day to all of you.